How's it going, you guys? So in this video, I'm just going to be discussing some of the best evidence we have for how to prevent heart disease and lower our risk of arteriosclerosis, and how we can just improve our health on all factors and improve our blood, our serum levels, serum markers for all diseases, what the best evidence is. I'll be sharing multiple studies with you guys. And just so everybody knows, I will be making another video where I go into detail about why the LDL theory on heart disease is it's weak, it's flawed, and there really is no evidence for causation, besides maybe like the Seventh-day Adventist study, which is again deeply flawed. There is no direct linear relationship between LDL and heart disease. And I have a video where it's Vegan Gains Exposed, where I break down the studies in detail, so look for that. Just search for LDL and chalice of immortality in the search bar, or search for Vegan Gains Chalice of Immortality, which is my channel name, in the search bar. If you want to find that, and I will be making a new video shortly where I go into detail. It'll take me like 30 minutes to debunk all the nonsense. So without further ado, let's get into why inflammation is at the heart of heart disease, and how essentially how you can cut your risk like drastically to zero. Okay, so first of all, this is an editorial review of the evidence. Saturated fat does not clog the arteries. Coronary heart disease is a chronic inflammatory condition, and the risk of which can be effectively reduced with healthy lifestyle interventions. It's in the British Journal of Sports Medicine. Okay, and it discusses the mechanisms and essentially how insulin resistance is a huge contributing factor to heart disease, and triglyceride to HDL ratio, and the fact that LDL cholesterol risk has been greatly exaggerated, and randomized controlled trials. They pretty much show that low-fat diets are pretty ineffective, or less effective than high-fat, low-carb diets, right? So we have that, and then here, this is basically discussing various mechanisms that contribute to heart disease, and what biomarkers we should be tracking to help prevent heart disease. And this is right here, linking chronic inflammation with cardiovascular disease from normal aging to metabolic syndrome. And it's just a good read for those of you who are curious about what to track. Essentially talking about C-reactive protein and insulin resistance and all these things in regards to heart disease, and how you can use blood tests to help you predict your risk, right, outside of LDL. Okay, then we have low-fat dietary pattern and risk of cardiovascular disease. The Women's Health Initiative randomized controlled dietary modification trial, and essentially it showed, so it was an 8-year dietary intervention, and it was spanning just about 50,000 participants. That's a lot of people, and it's a dietary intervention trial. These people actually were put on a low fat, low cholesterol, high vegetable, fruit, and whole grain diet, and they did not significantly reduce the risk of cardiovascular disease, stroke, and it hardly achieved modest effects on cardiovascular risk factors. So basically, they kind of gathered from this that more focused diet and lifestyle interventions may be more effective, right? But essentially a low fat, high fruit, vegetable, and whole grain intervention didn't really improve anything. okay, or didn't really show a significant improvement. Okay, metabolic and physiological improvements from consuming a paleo hunter-gatherer type of diet. Basically, this was a short-term study done, I think it was 7-10 days on a strict paleo diet, and they found short-term consumption of a paleo diet improves blood pressure, glucose tolerance, decreases insulin secretion, increases insulin sensitivity, and improves the lipid profiles even without weight loss. And this was done in healthy participants, okay, in 1 week. This is a short-term study. So even in 7 to 10 days of consuming these food, you get significant decreases in LDL was shown in this study particularly. But you guys can look at this yourself. Great improvements in the short term, right? And now here's a 12-month study. Yeah, 12-year study. That would be incredible. A 12-month study, right? This is a full text. The A to Z weight loss study. It's one of my favorite studies. Funny thing is, I actually sent a link of this study to Vegan Gains and asked him about, well, what about this? And he told me it's because they're fat, obese women, and so basically the Atkins diet participants were able to eat as much as they wanted as long as they stuck to Atkins principles. So it was not calorically restricted for Atkins. But for the other groups, the Zone diet, the Learn diet, the Ornish diet, and yes, why can't I zoom in more? The Ornish diet, there we go, the Ornish diet was calorically restricted in everything. And as many people don't know, so Ornish actually included exercise and all the other things that go along with the Ornish spectrum, at least if I remember correctly. So it wasn't just a dietary intervention for Ornish, it was the complete Ornish program. If I remember correctly. You guys can look at the full text yourself and analyze it. It's been a while. So anyway, Vegan Gains was all telling me like, oh well, it's because the Atkins was unrestricted consumption of all the fat and protein you want. And so of course a bunch of overweight, obese ladies they're gonna love the Atkins diet because it's just all the cheese and eggs and meat and bacon that they could possibly desire. And so Vegan Gains told me this is a shitty study because basically the overweight women most likely stuck to the Atkins diet like easily. And basically the reason why Atkins did so much better, there's a double and triple improvement compared to the Ornish diet, a plant-based diet, at 2 months, 6 months, and 12 months. Body fat percentage, hip to waist to hip ratio, LDL. Well, not the LDL. The LDL didn't improve, but the HDL to triglyceride ratio improved. Triglycerides drastically decreased compared to the Ornish diet. Double the improvement. In fact, triple at some points. Their hemoglobin A1C drastically improved. Blood glucose, their blood pressure. All of these things, drastic improvements, double and sometimes triple, even in comparison to the Ornish diet, which is supposed to be clinically proven to, treat these types of illnesses, right? And Vegan Gains' only response was that the Atkins diet, these fat women were able to follow a lot better than the Ornish diet. And so he thinks that the reason why Ornish diet didn't do so well and the Atkins diet did so well is because these fat women didn't adhere to these diets because they're calorically restricted and they weren't appetizing. And the Atkins diet was more appetizing and easier to follow, and that's why they had 3 times the improvement in their cardiovascular and diabetic risk factors. Now, on one side of things, sure, you could definitely say that, and it makes a lot of sense. Just like healthy user bias is most likely plaguing these Seventh-day Adventist studies, right? It's possible that the only reason why the Atkins did so largely better compared to these other diets is because Atkins is easier to follow. It's unlimited animal protein and whatnot. Now the thing is, Guys, if animal protein was really the end of your heart, the end of your insulin receptors, right? If it was really such a harmful thing, I mean, do you really think that they'd have triple and double the improvements in all of their risk factors for most diseases compared to these other diets? The Zone diet is a pretty balanced diet, 30% fat, 30% protein, and some like equal parts protein, fat, and carbs. Anyway, if animal protein was really that bad, I really don't think that unlimited consumption of it would, cause such amazing improvements in health, regardless of adherence to these diets. And also, the best diet for you is the best diet that you can adhere to. If you can't follow a diet to the T, if it's too hard to follow, then it's really not going to give you any long-term benefits whatsoever. And for obese women especially, obese people in general, the healthiest thing they could do is lose weight, even if they're losing weight eating bacon and whatnot. There are people who have drastically improved their health just by eating, calorically restricting McDonald's and whatnot. But, this isn't about caloric restriction. That's the point. They had unlimited amounts of animal protein, and they drastically decreased their risk for all diseases. The only lipid profile that did not improve is their LDL. But the thing is, lipoproteins are essentially a boat, is a vehicle that transports fatty acids, okay? And when you're losing weight in general, no matter what diet you're following, you're going to have a greater increase in LDL and HDL, no matter what. And so the more fat you are metabolizing, the more fat that you're mobilizing is the word I was looking for. The more fat that you're mobilizing, whether it's because you're eating a ketogenic diet or whether it's because you're losing weight, your body's breaking down body fat to use for fuel. And so it needs to be transported somehow, and LDL tends to be one mechanism in which it does it. And so, having an increased LDL, that could be the explanation for why. Obviously eating more fat, you're going to have more LDL and more HDL. But considering the fact that even in Vegan Gains' favorite studies, the participants who are eating more or have higher cholesterol levels, higher LDL levels, there tends to be more people with high LDL levels and no heart disease compared to the lower groups. There's only like 2 people who have low LDL and low arteriosclerosis or no arteriosclerosis. So anyway, I know how confusing this probably is, and I'm not making it any easier with my explanations and my jumbled up, fast-paced mental gibberish. But essentially, the evidence that LDL causes heart disease, you can say, oh, it's politics, it's this, it's that, blah, blah, blah. Like the vegan diet is not the holy grail of health. And mind you, like the Ornish spectrum and these other, the Esselstyn program, they include statin therapy, typically, and they also include healthy lifestyle factors, exercise and yoga and stress reduction. And, the risk of heart disease can be effectively reduced with healthy lifestyle interventions. To me, it seems like healthy lifestyle in general seems to be the most potent medicine for these things. The lack of a healthy lifestyle is what causes most of these things to begin with, but being on a low carb diet clearly isn't going to harm you, right? I mean, damn, son. Look at these improvements, guys. Like, really look up these studies yourself. I'll link them down below. So, yeah, I mean, exercise, do fasting, follow whatever diet is really going to help you and make you feel great. Most people, after they adapt to converting fatty acids via lipolysis to glycogen and converting specific amino acids to glycogen, like alanine, and burning ketones for fuel, most people probably feel a lot better eating this way. That's what I feel like, especially compared to the Ornish calorically restricted diet. But nonetheless, I feel like all these diets are going to help you over the long term. As long as you're moving in a healthier direction, that's what's up. But look, guys, there's a lot of bias and a lot of nonsense out there. So, and yeah, so another just a little bit of discussion here. The more whole animal foods you eat, such as like egg white with the yolk, chicken with the skin on, uh, the more endogenous antioxidants you're going to produce. This is a thing that a lot of people don't realize. A lot of antioxidants, including vitamin C, the only reason why they're such potent antioxidants is because they help to recycle glutathione, which is produced from cysteine, methionine, glycine, and then vitamin B6, choline, vitamin B12. These things convert homocysteine in your blood into glutathione. Animal products increase blood methionine, they increase blood homocysteine, and that homocysteine is converted into glutathione if you eat the cofactors found in the whole animal food. And so without the skin on the chicken, for example, the skin contains glycine, for example, and glycine is a necessary cofactor for glutathione, for converting homocysteine and glutathione. And if you just eat the white meat chicken, you're not getting as much glycine. Glycine ratios tend to be pretty low in muscle meat. And so that's why collagen and things like that tend to make people feel better, and they have it helps to heal joint pain. A lot of people claim, oh, it's a placebo effect, there's no mechanism, blah, blah, blah. Yeah, it's supplying your body with the raw materials it needs to produce glutathione and to, produce the cartilage in your joints, for example. Regardless of what you believe, animal products are the greatest way of increasing glutathione. And on top of that, you're reducing endogenously produced advanced glycation end products. So you're reducing the amount of inflammation that your body endures. You're reducing the amount of reactive oxygen species by reducing the binding of sugars to protein, okay, commonly found in meals consisting of carbohydrates and protein, for example. And you can say like the breakdown products of charred meats and the exogenous advanced glycation end products from animal foods are high and blah blah blah. But the fact is, it's all about the endogenously produced antioxidants and endogenously produced reactive oxygen species. That's what really matters, is what's in the bloodstream, not what's in the digestive system. Because the body tends to break down a lot of these advanced glycation end products that you might consume through food. But when you consume fructose, is one of the main ones. High amounts of carbohydrates in these foods, which humans have only had access to in higher amounts on a regular basis for 5,000 years or so. This high carbohydrate load, especially high glycemic load carbohydrates without the fiber in these things, it's going to be pretty ugly. It's going to produce a higher oxidation load, oxidative stress load, in which your body's going to have to neutralize with glutathione. Or, if you think like exogenous plant antioxidants, maybe. So a lot of people, they say, oh, like animal products are low in antioxidants. But yeah, they actually help your body, they give your body the cofactor to produce its own antioxidants. So the most powerful antioxidants in your body, superoxide dismutase and glutathione, which are endogenously produced inside your body. So these are big ways that it decreases inflammation, is through these endogenously produced antioxidants, and by reducing endogenously produced reactive oxygen species, decreasing oxidative stress, leading to a decrease in inflammation. Inflammation is a process of healing damaged parts, essentially damaged cells. You can think of it as. So, you guys examine the evidence for yourself, and if you still think a plant-based diet is better, honestly, it doesn't matter, because, even if you still think that, fact is, people get great results to their health on Atkins. Besides LDL, great, amazing results to their blood markers on Atkins. If you think LDL is that big of a deal, like, oh shit, like, sure, blood pressure decreased by like 3 times compared to a vegetarian diet. Weight decreased by 3 times the amount. You got 3 times the improvement on an Atkins diet for all, your insulin sensitivity, you reverse your diabetes and everything on Atkins. You feel so much better. Oh, but the LDL is high. Might as well just get on the Ornish plan, waste away, and then get significantly lowered improvements to my risk factors for all disease. Great idea. And I'll have to restrict calories. I mean, if a bunch of fat women can adhere to Atkins so easily, you'd think a smaller person would too. So anyway, a bunch of crazy nonsense with these people. Let me know what y'all think, and I'll talk to y'all in the next video.